Hi, my name is Jennifer Hall. I'm a student of physical therapy at the University of Central Florida. Today I'm going to go through and show you how to apply a cold pack. Today I have a patient who is status post 2 days an acute ankle sprain. I'm going to go through and show you how to apply the contraindications and so forth. The benefits of this for an acute ankle sprain are that it should reduce inflammation and edema, it should increase range of motion, and it should decrease pain. So before we start, I'm going to go ahead and make sure that the patient is cleared of all contraindications in order to use the ice pack. So, first of all, have you ever had any circulation issues?
No.
Have you recently had any nerve injuries?
No.
Have you ever had your fingers turn white or red or your toes after using ice?
No.
Have you ever had blood in your urine?
No.
Have you ever had an excess amount of protein in your blood?
No.
Have you ever had any rashes form or anything on your skin?
No.
Okay, and have you ever had any extreme pain after using ice? Okay, now that I've cleared the patient of all contraindications, I'm going to go ahead and set her up and prepare her for using the ice. Now I'm going to make sure that the patient is positioned properly. I'm going to make sure she has a pillow underneath her head for comfort. I'm going to make sure she has a pillow underneath her knee in order to support her leg. And then I'm also going to have a pillow folded twice underneath her ankle for support and elevation. And in order to actually do the icing, I'm going to be using a cervical size gel pack. It's about 40 degrees, and I will be putting it on the patient for about 15 minutes. Before I actually apply the gel pack, I'm going to tell my patient what she's going to be expecting. So you said you've used a gel pack before. I just want to let you know what you're going to be expecting to feel. So it's going to feel cold first, then it's going to feel like it's burning, then you're going to feel a little bit of aching, some decreased pain, and then finally it's going to turn out. Okay? Before we do that though, I'm going to check your sensation in the area.
Okay.
So I'm going to test this by touching her foot. She's going to be looking up toward the ceiling so that she can't see the area, and she's going to indicate when she can feel the touch. So please tell me when you feel it.
Okay. Feel it. Feel it. Feel it. Feel it.
Okay, so since she does have sensation in the area, I'm going to apply the cold pack. What I've done is I wrapped it in one layer of a pillowcase. I'm going to put, for some insulation, I'm going to put that down on the top of her ankle. I'm going to lift her ankle up so that it wraps underneath. And because of her body weight, I'm going to just leave it there because it's holding it down. If for some reason she wasn't able to have it held there, I would use a wrap or something to hold it in place. I'm going to leave her for 15 minutes, but I will come back and check on her about every 5 minutes just to make sure that there's no redness in the area and that everything feels okay. So now it's been 15 minutes and she's left the ice on. I did check back on her every 5 minutes, and each time she said she had no tingling, no numbness, etc. So what I am going to go ahead and do now is remove the ice pack from her ankle. And when I do this, when I was checking back on her, she had normal blood pressure, she had no numbness, no tingling, so the precautions for that all seemed okay. From this, I would expect to see her having increased range of motion, decreased pain, and decreased inflammation in the area.